there's lots of trends in aesthetics. So we'll see lots of new techniques and buzzwords and all that kind of stuff floating about. And there's new this, that, and the other. It is worth, when it's a treatment and you're offering it to your patients and it's their faces, not just jumping in straight away, both feet, and thinking, right, I'll offer this, or let's, catch this before it goes viral and it's trending and all the rest of it. It's about making sure that it's a good product, that it's a good technique, and that it's a good treatment to introduce to your clinic, really. So definitely what I learned and in my masters has never left me. It's about knowing how to evaluate things and just not rushing in just for the sake of something new. Yes, we've got to evolve and offer the new things that are out there because they're developing and everything's getting better and better, but making sure it's done in a safe way.
Hello, and welcome back to the Face It podcast, run by Faces Consent, an app by practitioners for practitioners. I'm your host, Jess, and today we, of course, have got a brand new face to the podcast. I just want to mention, though, as my usual, don't forget you can rate, review, and subscribe wherever you get your podcasts. There's so much information, tips, industry advice available now on this pod. We've hit well over 100 episodes of this show. Share with your industry friends. Let them know all about the free tools that we have on offer here at Faces. It's the perfect kickstart to any new business. If you'd like the chance to come and chat to me about your experiences, share your stories and your expertise, then of course you can let me know. You can find us on Instagram at FaceItPod, or you can message me personally at Jess_Messenger. It is though now time, of course, to introduce our guest today. So a big warm welcome to Natalie from Naturally Flawless Aesthetics. Welcome to the Face It podcast, Natalie.
Hello. Hi.
Thank you so much for joining us today. I'm going to jump straight into your background actually, because I'm interested to know how you got into aesthetics. Did you always want to be a midwife growing up? And if not, how did you find yourself becoming a midwife?
So, not specifically a midwife, but I knew I wanted to do something medical. I'd always been really interested in science and was a bit of a geek really in school. So, really loved biology and chemistry. And knew I wanted to do something medical, but didn't really want to do the nursing side or like a doctor side of it because I just didn't want to do something to do with illness. So I know that sounds really funny. You think, oh, a medical professional will deal with illness, but pregnancy and having babies is a normal, natural thing. So that side appealed to me a lot more, really. So it was helping people in a medical sense, but not necessarily dealing with people that weren't very well. They were very well, and it was a normal part of life for someone. So, yeah, a bit of a different way into it, I guess, but medical nonetheless.
Yeah, that's interesting. I never thought about it like that before, actually. Like, sort of that being the reason. Because I think a lot of people get put off by going into medicine as a whole, because of that illness factor. Like, I know my mum always thought she wanted to be a nurse, and then decided not to be a nurse because she was like, you know what, I can't handle ill people. But there are other avenues, like you say, where you can still get that sort of hand in the industry, but not necessarily on the A&E end or the ill end.
Yeah, and make a difference and help people, but not at a time in their lives where they're poorly, essentially. Whereas when you encounter a midwife or you're having a baby, you're fit and well. It's a normal physiological process. So, yeah, that was my way into it, really.
Do you still work as a midwife at the moment, or have you left the industry altogether?
I left. I left about a year ago, but I still maintain my registration. So I do bank shifts. So I'll always keep that up, um, but not contracted hours anymore. The business just got busier and busier, and it just became a ticking point where it needed me more and more. And yeah, so I left about a year ago.
And well done for keeping your registration as well. I think that's always a really, really good idea. It just keeps you kind of in touch with the industry, doesn't it? It keeps your medical knowledge up to date as well. Because I know it's a different industry, but it's all relative. Like all of those skills are completely transferable. And you're still maintaining all that sort of touching base with clients, with patients. So yeah, I think it's a great idea to keep that going if you can. And I was interested to know, where I was digging around a little bit about you online, Natalie, as I normally do. Why did you decide to study for a master's in clinical research? I thought that was really interesting.
Yeah. So, as I said, I've always been a little bit of a geek, really. So, went and did lots of different things at university, topped my degree up as a midwife, and then was like, what else can I do? So, I did mentorship and then looked into what sort of masters I could do. And with anything, though, so with anything medical, aesthetics, in the same, we should never be standing still. So, always looking at different treatments, different techniques, different ways that we can better our practice because the world of medicine and this as again, the same goes for aesthetics, it's moving and it's moving quickly. So we should be up to date with that. So I took a year out, it would have probably been about 2011, so a long time ago now. Took a year out from midwifery for a year and went back to university and did the masters in a year. So it was intense. There was a lot of um it was tough, but it was very rewarding. And then you got that set of skills and you've demonstrated you can learn to that level and at master's level. It's sort of a skill that never leaves you really. So and in the same way that's completely transferable to aesthetics where there's new practices, new products, new techniques coming out all of the time. And it's about knowing how to evaluate what's good and what's not. Reading papers, looking at new pieces of research, looking about, at how the research done and is it good, strong research and should we change our practice?
It's interesting you say that as well, because there's always new products that flood the market. There's been a few the last couple of years. And so it's very easy for people to just jump on those trends without having done that research for themselves. So I can imagine you will see this new product, it's hitting the market, it's going viral. Do you just take a little bit of a back seat and think, I'll just wait and have a look at the data on that?
Do I do. So it is. There's lots of trends in aesthetics. So we'll see lots of new techniques and buzzwords and all that kind of stuff floating about. And there's new this, that, and the other. It is worth when it's a treatment and you're offering it to your patients and it's their faces, not just jumping in straight away, both feet, and thinking, right, I'll offer this, or let's, catch this before it goes viral and it's trending and all the rest of it. It's about making sure that it's a good product, that it's a good technique, and that it's a good treatment to introduce to your clinic, really. So, definitely, what I learned and in my masters has never left me. It's about knowing how to evaluate things and just not rushing in just for the sake of something new. Yes, we've got to evolve and offer the new things that are out there because they're developing and everything's getting better and better, but making sure it's done in a safe way.
Mm. Yeah, I can imagine that your career in midwifery, but also that extra level of studying clinical research has really made you sort of the practitioner that you are today, really, and given you that edge. So yeah, I'm interested to know, how has your midwifery and educational background shaped what you do now? Like, I know we've touched on the fact that you're a little bit more cautious, maybe jumping in on trends. Is there anything else that it's kind of you can clearly see has helped shape the way that you practice with your own clients?
So a lot of my degree and my masters, and then when I went on to do my prescribing, a lot of that is about ethics and patient-centered care and the NMC code and making sure that we're practicing with our patients' interests at heart. So I'd say they're the big thing. It's like a lot of it was about ethics and why we do things and making sure that the things we do are in clients' best interest, really. So again, bringing it back to not just doing something because it's a way to make money or it's a trend or we think we should be doing it because everyone else is doing it. A lot of that comes into a big part of that comes into the products that I choose to use. So when you decide to put things into your clinic and what products you're going to go with, that's a massive part of the treatment. What is the actual substance that you're going to put into.
So, how has your midwifery and your educational background shaped what you do now?
So I would say the one of the big takeaways from doing my midwifery degree and then my prescribing and a mentorship qualification and my masters was all about ethics and making sure that we're acting with the patient's best interest at heart. So making sure that we're doing, as I've mentioned, a lot of research into why we're doing things. Is it the best way to do things? A big thing for me is what kind of products you use in clinic. So there's a massive array of different products to use. And whilst it's not the cheapest option, making sure that I use very premium products because it's in the patient's best interest. It's the highest quality thing you can buy. And if you're putting it into your face, in my opinion, that should be the best that you can get. So again, whilst it's not the cheapest option, as a practitioner, thinking about ethics, thinking about the NMC code, about putting your patients first, the things like that, really, they're the things that I've learned in a medical sort of domain that are transferable into this and that stay with you every day, really. When you're looking at a patient and they come to you for a treatment, I will frequently say no because I don't think that it's the best thing for them or that's not the right treatment. You'll get a lot of people that will say, oh, you did my friend's lips or chin or jaw or cheek, whatever that might be. And then they come and ask for it and they'll come and sit down and I'll say, I don't think that's the best treatment for you. So about knowing when to say no and not just thinking, oh, well, it's another treatment and I could take your money. It's not about that ethically. We're on a register, we're an MC registrants, and it's about thinking, is this the best thing for the patient? And if it's not, sticking to your guns and advising them no or saying no.
Yeah, I couldn't agree more. I mean, I come from a dentistry background, so, you know, for us it was BDC, so but I completely get it. Obviously, the code of ethics and things is something you live by, and I don't think it's something you forget once you've learnt it and lived by it. You know, I've been gone from dentistry for 5 years now, but when you've lived by it for so long, that's just how you conduct yourself as a practitioner. You know, I do PMU, so it's not aesthetics, but I work very much in the same way. Um, it's so ingrained in the way that I treat. It would feel very alien to operate in a way that's not aligned with that, just because it's like riding a bike. Yeah, yeah, absolutely. Yeah, completely agree. Um, this might be the question that you weren't keen on, Natalie, so I'll ask it anyway, and we'll see if I'm right. There's obviously a lot of debate at the moment around medic versus non-medic. I was interested to know what your standpoint is on it. It doesn't necessarily mean that you've got a preferable side, but just from someone who's got that medical background, I've got my standpoint on it. I'm intrigued to know what yours is.
So I think it's very personal. I don't think it's not something that I like to get into. I think within medic and non-medic, there will be great practitioners and great injectors, and there will be skill in both camps, absolutely. I think it's down to the individual client and it's their preference. And if they would prefer and it makes them feel better to go to somebody with a medical degree that has trained, say, to degree level and maybe master's level is a prescriber that has got that medical background and that makes them feel more reassured or at ease with having a treatment, then that's probably something that they need to do. Some individuals don't mind at all, and that's absolutely fine for them. So I don't think one's better than another from a knowledge perspective, anatomy perspective. Would a medic have the edge? Maybe because they've been to university for 3, 4, 5 years. And obviously with that comes experience. But I think it's down to the individual client. And if it makes somebody feel better to go to somebody that's got a medical background, then that's something that they need to do.
Completely agree. I think I come from the same standpoint really. There's a client for everybody. You know, in that it's just a different client base basically. And it's the same with, like you say, you get skilled and non-skilled on both sides of the camp. You know, I'm sure through your career as a midwife, there's been questionable, you know, individuals in the industry. There certainly has when I've been involved with dentistry. You know, they've done years at university. It doesn't make them a great dentist. So it's one of those. It's always down to the individual, whether that's the practitioner or the client. And I completely agree on that. Moving on. What is it about aesthetic medicine that you love the most?
Oh, everything, everything about it. So I think in a way it's quite, I'm never surprised that I've ended up here. So in school, I was very academic, loved biology, loved chemistry, wanted to learn all the time. But even as a younger, like 11, 12, 13, all my school reports would say Natalie's very academic, she applies herself very well, but she also wants to have a fine lip gloss in the classroom. So I was constant, like, always still into beauty, always into like I remember going around Boots with my mum and looking at Estee Lauder and being obsessed with like things that you could put on your face to make you look a certain way, and mascara and having lip gloss every day at school. So it's and now this is the perfect blend between both of those. So it's
Yeah.
aesthetics is the science and the biology and even the chemistry that's in, the products combined with the beauty element. So I'm like, I'm 100% not surprised that I've ended up here because it blends the two perfectly, really. In terms of the best parts of it, it is 100% making people feel better about themselves. So I love that, like, the relationship I've got with my clients is amazing. A lot of them are like friends. I love that side of it. Like, you meet so many people, so many different clients from different walks of life. They're just so interesting. So I love that side of it. Like, and similarly, I suppose midwifery is quite similar to that in that you are meeting new people all the time. But definitely the best bit for me is making people feel better about themselves. They come with a concern or something that they want to enhance, giving them the mirror, and they just feel so much better about themselves. Like, that is amazing. Like, that's something that you never get tired of ever.
I think that's what's so nice about your kind of like dual career in a way is that you've had that job satisfaction throughout because I can't apply the similar thought process to dentistry really. Like the job satisfaction, everyone's not there because they want to be there. You're not having a baby, it's not the best day of their life. Um, most people don't want to be there or they're petrified or they're going to be in pain at some point. So it was hard to find that other than helping people, it was really hard to find that job satisfaction, but I feel like you get that out of midwifery and, delivering the best moment in someone's life and helping them through that journey. And on the flip side of that, now that you're, running your aesthetics clinic, you get that as well out of that sort of
Yeah, the way to it
pride.
pops you flat experiences. So
Y-
yes, they're medical, but it's like the best bits of it that you could
Yeah.
help somebody with.
Yeah, you've picked well, Natalie. You've done well there. You've been selective. So, what made you decide to become a prescriber, and how did you find studying for that particular course? Was it quite
Season. It was difficult. It was difficult. I did it whilst I was working in the NHS. So it was a big undertaking. There's a big pharmacology point, like part of it. It's very academic, and my masters had prepared me quite well for it. But it was a big undertaking with also working for the NHS pretty much full time. Um, but it's again about taking opportunities to better yourself and thinking about although it's like short term pain for long term gain, really. And again, the knowledge, the experience that brings you as a practitioner and that you can then deliver in your clinic. So a little bit more knowledge that you can use to better your client experience. So it was a bit of a no-brainer for me. Like, there was an opportunity to learn, to do something more, to develop my skills and my knowledge. And I've always just taken them every chance I've got to do something else and learn. I've sort of jumped in, really. I brought it with both hands.
Are you addicted to knowledge, Natalie?
Yeah, and again, that comes from like a clinical research background, being able to know more and know the best and always keep up to date. Like, it's something that never leaves you. You can't shake it. Like,
It's quite an addiction, isn't it?
curiosity to want to know, yeah, to want to know more, do better, advance your skill, advance your knowledge. You just can't. It's something that's within you. I think it's either there or it's not.
I agree. I think as well the safety and knowledge. I know for me, because you're very similar to me like that. It drives my husband up the wall because I'm never done. There's always some other course or some other qualification, or it must drive him mad. And I've got the sense that you're very, very similar. It's like, when are you going to be done? And I don't think I'll ever be done. But I think it's because I find safety in the knowledge. And when I don't know something, I feel unsafe and I don't like that territory. For me, I would rather know as much as there is to know about a subject, because then I feel quite calm in what I'm doing. I don't like that swan feeling where I look okay on the surface, but I'm doing this underwater. And
In out of depth, yeah.
I hate that. So I wonder if you're quite similar, that it's that safety and knowledge that keeps you driving you towards learning more.
And I think we've got a duty to our patients as well. You know, it's all very well and good offering a treatment, but it is the responsibility lies with you to know as much as you can to keep training to make sure that you're delivering in the best way. As I say, picking the best products, making sure that your skills and techniques are as good as they can be. And everything's changing so quickly. You need to stay on top of that. So learning will never ever stop. And rightly so, I think. Rightly so.
How has being a prescriber helped you in your business as well?
So obviously, there are certain treatments where a face-to-face consultation with the prescriber is the law. So that means that my clients aren't seeing somebody else. They come to me for the whole thing. So I will do those consultations. I prescribe for them. I do the treatment. It is everything's with me. And that's how I like it, really. I think it's me they're seeing. They want to come to me. So it almost feels only fair that I'm doing their whole part of their treatment. And as the prescriber, it means that it's like another level of knowledge, really, that I can bring to them rather than saying, "Yeah, you can have this, but I need you to see somebody that can prescribe it for you." It's yes,
And it
it's a
speeds up your process as well, doesn't it? You know, it just
process.
means that you can keep that momentum going without having to, like you say, bring someone else into it, map it to their book and their availability. It automatically makes your clinic a lot smoother.
It does, and it makes it smoother for the client as well. So they're not having to negotiate a time with somebody else, then come to you and all the rest of it. And it means that they're coming to one place, it's one person, and that person is responsible for their prescribing and for their treatment.
Moving a little bit to your sort of specialism then, Natalie. So obviously we know the name of your business, Naturally Flawless. And so you specialize in more natural enhancements. What is your favorite treatment at the moment? Do you have one? And if you do, why is that your favorite?
There's probably a couple, if I'm honest. So I love a really natural lip enhancement. I think they're amazing. There's lots of unnatural work out there. So I do think natural lip enhancement particularly is quite is quite hard to come by. So I love a natural set of lips. I'd say, there's loads that I love. Mid-face filler can be completely transformative, absolutely amazing. Um, there's not many people that wouldn't benefit from a little bit of mid-face filler, and just to restore what's been there previously. It supports the whole of the lower face. It really is amazing. I love doing a tear trough filler treatment. Again, on the right client, it can be just unbelievable. Um, so yeah, there's several that I love, all for different reasons, but they're the ones where I'm like just at the end.
When you've got one
I
booked
just
in, you get all excited.
yeah, yeah, yeah. And
Are there any standout moments for you?
they're the treatment that really like make a difference to somebody. So you know, having anti-wrinkle treatments, they make a difference, but you don't see that immediately with a lip filler or mid-face filler, tear trough, it's instantaneous and it actually gets a bit better. So they're the ones where you hand them the mirror and they're just, blown away, which is amazing.
Yeah, it's that instant satisfaction, isn't it, for you and for your client, really? You get that instant moment of like, oh my God, that's exactly what I've been looking for. And I think as well, a lot of clients don't necessarily know what they're looking for. They just know they don't like something. So, for you, it's your job to be able to point out what that right treatment might be. And they might think it's one thing because they've seen on Instagram that cheek filler is the answer to all their problems. But actually, you might say, well, no, actually, there's this other treatment that I think is going to get you there. And it's being able to take them on that journey, isn't it? Because I think that's a lot of the problem now. There's so much information for clients online that they get an idea in their head of what they think they need, and it's about trying to re-educate them that that's not necessarily the right thing for them.
Yeah, it's going back to that thing that not all treatments are right for all clients. So you'll get a lot of people that will say, "Oh, you did my friend Chi." and it looks amazing, and it's really sharpened up her jaw, and it's brought everything forward, and she all looks in proportion from the sides. So I need mine doing, I don't mind it. Can I book in? Can I book in? And then you see them and you'll think, well, turn to the side, and I'll often show them and be like, you don't need this. That treatment isn't a good treatment for you. Whereas your friend has a completely different facial anatomy to you. The proportions of her face are different. So it's not something you need, but for your friend, it's amazing. So it is about just, there's a lot of noise out there, isn't there, about
So much.
lots of treatments, and it's about knowing what will benefit somebody and what won't, and being honest, being very honest with clients. So I always say I'm very, very honest, and I'd rather under promise and over deliver.
Oh, yeah.
So I'd always rather say to somebody, this is a treatment that will be great for you, but these are the limitations of it. And somebody be, which touch wood, they are, and thrilled with it, then think, oh, I'm not quite sure that I got the same result as my friend. But that might be because it's not the best treatment for them. So just being very honest.
Yeah, I always go along the underwhelm with my conversation, and then hopefully overwhelm and excite when they've actually got their result. And yeah, you definitely learn that the hard way. I think working in dentistry, at least I did a lot of cosmetic dentistry, so you learn that skill by watching other practitioners do it. Are there any standout moments for you in your career, either personally or professionally?
I would say, so academically, it is the masters and the prescribing. And so those achievements are something that you never lose, and they'll stay with me always. So, yeah, very proud of those. Aesthetics wise, so I've done quite a lot of cleft lip fillers, and I don't know, well, it just came from one person that contacted me, and she just said, I love that you do such natural lips. I love that they always seem to just look really balanced and nice. I've seen that you use really high quality products, but I've got a cleft lip and I had it repaired as a baby. Could you do my lip filler? I've spoken to lots of other people that have said they won't do it, that it's not something they'll do. Um, and so I did. So she came, and then the message sort of got out from there really. So I've had quite a few over the past sort of 18 months, a lot of people that have had cleft lip repairs as babies or children are then coming and having lip filler. And it honestly is, of all of the treatments I've done, like they're the ones where it's such an amazing transformation, and the difference it makes to someone's life is incredible. So a couple of the clients have come with their moms, so it's something they've been thinking about for a really long time. The moms are probably quite nervous,
Yeah.
especially plus as children. Their children have gone operations to their lip, and it's been a very daunting experience for them. And both times that's happened, and everyone's been in tears. So the mum's been in tears because she's thought that it's been amazing, the transformation's been so, the client's been in floods of tears, and I've started crying because it makes such a difference to someone's life. I think especially as a young woman, and at the age where you are starting to put makeup on, and your facial your image is important to you. So being able to make such a difference for somebody is just amazing, absolutely amazing. And I'd say the word just got out, word traveled, and more people would message them saying, I'd heard that I've seen you've done this cleft lip transformation. Could you do mine? My daughter has had a similar thing. Can she come to you? Yeah, it is. It's just amazing.
Yeah, it's such a journey, isn't it, when they've gone through all of that, like you say, from a very, very young age, they've had multiple surgeries. There's a lot of anxiety around it. They've got themselves to a stable position probably where they've almost accepted that. And then they're exploring this new avenue, and it must be quite scary for the parent to be like, we've just got them to this place where they're relatively comfortable in themselves, and then they're going to go and kind of electively do this thing. So I suppose you have to handhold quite a lot through that, and, like you say, it's not just the individual, it's the parents as well that have seen them go through that.
So a lot of clients come for cleft lip repairs have, like they've said, oh, my dad's really unsure. They've come with the mum, but the dad's like,
Yeah.
and I understand that completely, because they will have gone through, as I say, other procedures and operations. as babies. So it's all quite daunting, isn't it? And then they've sent messages after like, my family can't believe the transformation. Then the mum's message saying, I can't believe thank you so much. I can't believe the difference you've made. It's honestly like
Wow.
and things for her. So yeah, there was said I would think this almost doesn't feel like work. Like
Yeah.
I do this for free. This is just
Yeah.
amazing. And that's the similar bit to midwifery, where you think I'm making such a difference. It's such an important part of someone's life that it doesn't feel like work. It's a pleasure, really.
Yeah, I mean, and like how interesting that it's not something that you strived to do. It just sort of landed in your inbox one day, and then it just sort of took a life of its own, really. And now, people seek you out because you've got this natural ability. I think because of the results that you give as well, that more natural enhancement, you just fall perfectly into that space, and people need someone. So yeah, kudos, well done
It
to you.
definitely owned me. Like it wasn't something I went to go, get. It literally just landed. It came to me. So, yeah, I'd say in terms of transformations of things that stick out, that that's probably it. If I had to do one.
Yeah, well done you. That's incredible. You've got 8 clinic locations now spread across the region. How has this helped you in growing your business in aesthetics?
So I would say I so when I was a midwife and I was working full time, I lived in Derby, but I worked in Sheffield. So I did a lot of commuting anyway. And I was always anywhere between Sheffield and Derby all the time. So it was a natural thing really that I would have a couple of locations, because I was already covering that area almost in my day to day. I suppose it's double-edged really. It does give you a different client base and a different clientele, absolutely. It gives a little bit more of an offering to your clients because you're giving them an option. You could see me here, or here, and you're giving them an option, um, because some things will work better for others. It might be closer, the dates might work a little bit better. So it does give a little bit of flexibility to my clients. The only thing I would say, you do have to work harder at building that client base in other areas. So if you're just in one place, that's where all your focus goes. Whereas it does mean you have to work a little bit harder at developing your brand and your business in all of those different locations. So there's positives, but like everything, it takes a little bit of hard work.
Anything worth having takes hard work, Natalie, though, as you've already demonstrated, I think, throughout. Is there a treatment out there that you wouldn't do as an aesthetics practitioner? And if so, what's your reasoning?
So rather than it being one thing that I would absolutely say I would never do that, I'd never offer it. I think rather than one particular treatment, it's about making sure that you don't do a treatment that's wrong for the client. So rather than it being one specific thing, it's about not offering a treatment that's wrong for the individual rather than a blanket, I would not do this altogether. So just going back to that, being very honest, making sure that you advise people ethically, making sure you stick to your guns, and making sure that you act with your client's best interest at heart. So, not every treatment is right for everybody. You get a lot of people that will say to you, "Oh, I'd love. I've previously had my lips done, and I'd like some more, and I've not had them done for a year, so I'll be fine." And then they come to see you, and you think, your lips have already started to migrate a little bit, or there's currently like there's no room for me to put any more filler in. And rather than just doing the treatment, it's about taking a minute and saying, no, I'm not going to do the treatment for you. If you do want more filler, we need to probably dissolve what's there already and start again, and really be honest and speak to somebody about that journey rather than just thinking, yep, okay, so they're booked in, so I'll do this treatment and I'll take the money. It's about being very honest with people and, yeah, acting with their best interests at heart. The same thing goes for, say, tear trough treatment. It's really a treatment that is not appropriate for everyone. That anybody with eye bags or anybody with lack skin under the eyes that carries a lot of fluid there, doing a teardrop treatment will not be for them. It will not give them a great result. So being very honest and not just thinking, yeah, well, you booked in for it, so I'm going to do that anyway. About knowing when to say no rather than one specific treatment that I would avoid altogether.
It's a good way of spinning that question, really. And, it's about really knowing your treatments inside out. A lot of courses now, you can qualify, and I think it's like 15 different treatments in like 5 days. I've seen some courses, and I'm thinking, how can you really understand everything about a treatment
You
by
can't.
doing that. You just can't. So, for me, I suppose an interesting question would be, what changes would you like to see in the industry? Because I think for me, I'd like to see it slow down the training, slow down the career progression, and slow down this need to offer absolutely everything at once. I think just slow it down. I think that would be my one of my key things I'd like to see. Is there anything that, for you?
I think when I'm sort of on social media, I'll always try and do a little bit of educational stuff. And I think that's really important because it's about arming people with the knowledge to make their own decisions. So I'll speak a lot about treatments and what they can achieve. I'll speak a lot about products and what the differences are. You can probably buy a box of poor quality filler on the internet for not very much money. But about knowing, because clients would think, well, I'm going for filler. Filler is filler. And it's not. And about educating people and saying, well, actually, no, we're going to use something that's 4 or 5 times that price. And this is why. So for me, it is about education, um, knowing the difference between certain techniques or, just equipping people with the best knowledge so that they can make an informed choice about their treatments.
Mhm. Yeah, I couldn't agree more. Completely agree with you. Moving on to content types, actually, it's interesting that you just brought up, the kind of content that you like to post for your patients. I saw a video on content creation types and the current trend of posting celebrity pictures and
Mhm.
dressing down their image or their aesthetic choices. And I thought it was, it's amazing what you said, and I completely agree with you. What do you think our responsibility is as practitioners, and how can people ensure that they're doing the right thing in the industry as well as for their clients when it comes to content creation?
So I think it's generally about, I just think it again, it's about educating people in the best possible way to maybe say, I mean, I am all about natural aesthetics, as the name suggests. Like from day one, it's just about natural enhancements, best quality products, helping people feel better without doing anything. I always say, don't do something fashionable with your face. Don't go for trends. Like, I've never done a set. I've never done a set of Russian lips, like, never, ever once. I've never done it because it's just not my bag. It's just not my thing. It's a fashion, butterfly lips, Russian lips, keyhole lips. It's just, they're phrases that come up and they'll come and go. So for me, it's just not for me. So the content that I would prefer to put out is educational stuff. I think rather than pulling up a picture of somebody and saying, this person has had, I think she has had ABCD done, and this is why I think it, and this is what I think to the result, and I think it's done really poorly and really badly, and don't her, like I say, Russian lips look terrible and she's overfilled and this, that, and the other. Um, I think that is, I don't think it's very kind. I don't think it's very kind, really, um, to do that. I think it's much better to look at the positives of something or and say this is what can be achieved and this is probably a great way to do it. Again, stay positive rather than picking up on negatives. I think people do it because it's interesting. People like to talk. People like an opinion, don't they? And they like to see other people passing comment on
Yeah,
interesting
unfortunately,
subjects
the
and saying
the
positive
algorithms
things.
reward yeah, the algorithms reward that content type, unfortunately, and that negativity breeds negativity, and unfortunately, that is the way that our social medias are constructed now. Is that the more negative or the more insightful that something is, the more traction it will get, and therefore it means that more content creators or practitioners even start creating more of that content because it's getting rewarded. But the problem with it is it creates that negative image of the industry as a whole. And, can you imagine being a client of someone's, seeing a post, might be a celebrity, but thinking, "My lips look like that," or "My cheeks look like that," you know?
It's almost saying, well, if I was a client of that person, they're very happy to say, this is also, they've had this done and they did, they think they look good, but they've had terrible work done. Or she's very overfilled and this is this, that, and the other. Um, yeah, I think it would put probably a doubt in their mind that, well, you're quite willing to go on and say, I think this person looks really bad.
And I think as well, it's that be kind thing as well, isn't it? Like, even if someone's been on television, a lot of the Love Island girls get a lot of this. Um, they're not bulletproof. They are people. And, they're happy with their face. So why should we make judgment or comment on it in a public domain? And, think about how that will affect somebody. And I just don't think bringing it back to the ethical way of working, I just don't think it's a great way of working. There's so many other content types that we can do. There's so many other ways we can talk about our services that have a positive influence on the industry rather than a negative one. So no, I really enjoyed that video that you did, and I thought it was a really good take on quite a popular trend at the moment. Um, I think we're coming towards the end of the interview now, Natalie, but I'd love to know, what advice would you give to other practitioners that are coming into the industry today? So, how long have you been in the industry, Natalie? It's been a while, hasn't it now?
So it'll be 3 years. It'll be 2 years. So advice that I'd give somebody is don't do the course that you were referring to earlier, where we're learning from 15 treatments in a day, or it, it is like something to rush into. It absolutely is not. It's a great industry, but it takes a lot of hard work. It takes a lot of learning. And you learn really by doing the treatments, getting the experience. It isn't just something that can be learned over the course of a day. It absolutely is not. There's a lot more to it than getting your certificate at the end of the day and off you go and getting your insurance. There really is a lot more to it. Um, Take your time. Don't run before you can walk. Don't try and offer everything from day one. Make sure that you perfect your skills and really take the time to develop your skills in each different treatment before you move on to another one. To make sure that you are being safe, that you are being um, the best that you can be when you're offering that treatment to your clients. Really, invest a lot in your business. Invest a lot in your practice. Um, in all areas of your business, really. As you said before, anything worth having doesn't come easy and it takes a lot. And I think people see it and they think, oh my God, this looks great. And it's, all singing, all dancing. It's not that straightforward. It takes a long time. It takes a lot of hard work.
Yeah, I mean, I always like to say to people, if you were wanting to be a lawyer or wanted to be a doctor, or there would be this period of education, there would be this 5 year, you know, place where you go on placement, you work, you gradually ease yourself into the industry. You don't just kind of go do it. You've done it at the end of the week and then you kind of let loose and you just go off and, represent someone in court, or, you treat a patient. So there's this process. And I think that that's what's lacking in the industry at the moment, is this respect for the process. It's not about how quick you can get to market and how quick you can get to offer all these different treatments and be competitive with your, neighbor. It's about becoming, mastering one thing and then moving on to another thing and really understanding and mastering that art, and then moving on to another, really understanding and mastering that, and building your offering out for your clients, really.
And that's what will give your clients the confidence in you, because
Absolutely.
learning no, they know when people know what they're talking about. It's their face at the end of the day that they are trusting you with. So they won't just go to somebody, if you've not got, yes, you might have learned the technique, of doing lip filler. But as they get talking to you, they will know if you know about your anatomy, they'll know about the advice you're giving to them. And we owe it to them really to make sure that we've got that knowledge and that we are as safe as we can be. But yeah, clients will know, and that's the difference.
Yeah, I completely agree with you there. What's next for you then? What's next for Natalie? What's next for Naturally Flawless Aesthetics?
I think eventually I would like to do some sort of training. So I am a qualified mentor. So again, one of the things I went back to university to do was a mentorship qualification. So I think that's something I get a lot of messages about at the moment. So when are you going to be training other people, or could I come and train with you? Do you have shooter days, shadow days, that kind of thing? So I think that's something that I won't be able to avoid for much longer, really. I get quite a lot of questions about it. So I think
Mhm.
that's something next.
I think the student sort of the shadow days are a really good thing, and I think we could definitely benefit from more of that type of stuff in this industry. You get it a lot in medicine. There's a lot of shadowing and things. And I think we could definitely benefit from doing more of that and doing it long term. Having that period of 18 months where you go in and you shadow someone and and various different practitioners as well, because everyone works differently. And I think there's something to be gained by shadowing and working with lots of different practitioners and seeing how different practitioners work.
So if you're in training to be a nurse, a midwife, a doctor, a lot of your time is spent on placement where you're working with your peers and you're working with seniors and you're learning from them all of the time. And like you say, you cherry pick things from them. You're like, they do that really well. The way they do this is great. And you pull it all together to make your practice your practice. So yeah, I think that's a big part of learning and something that I get asked about quite a lot. So I think that will probably be next.
Yeah, I think you'd be a fantastic mentor, Natalie. So yeah, good luck with that and keep us but if you could just let our listeners know where they can find you, where they can find you online.
Yes. So it is Naturally Flawless Aesthetics on Instagram. So that is where um, all of my clients really have ever found me. So that's the best. That's the best place to find me and have a look at the business.
Thank you so much, Natalie, for joining us today. You've been an absolute pleasure, and you've done amazing things already. And I'm excited to see what comes for the future for you, for Naturally Flawless. I'm sure you'd make an incredible mentor. So best of luck rolling that out, and maybe we'll touch base in a year and see how you're getting on. And if there's anything that we can do at Faces to help promote you with that, to help promote if you do courses or anything, then of course just let us know. If there's some way we can get involved and help do that, we will.
Thank you.